Well, I'm delighted to have with me this morning Lucinda Thatcher, who just basically set the entire room alight with the student session, with her story, which I'm going to ask you, if you don't mind, just summarising it. You really did win the hearts of everybody in the room by what you said, and I think everybody respects you for that hugely. Could you possibly shorten what you said into about a minute? Because I want to expand on that. If you could just bring down, in effect, 12 months down to 1 minute.
Okay, so I was doing my GPEP 2 year, and I just sort of said how it was the worst year of my whole 33 years, and it was for a multitude of factors sort of related to time pressures with family, work and study, and how that just had a really negative impact on my mind and how I coped with things, I suppose.
Well, that's a really good summary, and certainly you did it over about 20 minutes, but immediately afterwards Joe Scott-Jones stood up and just announced welcome back to the network, and that really was what the network enjoyed helping people through. But you sort of almost did it on your own. You got through it not quite on your own, but almost. So what help did you get to bring you back to where you are now?
Well, I think after I sort of had that day that I broke down into tears, and then I actually started admitting that I wasn't really coping, and so then I had my GP teacher and medical educators, and just sort of doing some changes at work, so in terms of time, and I'd had longer consults and started work later, and then also with my family. So just my husband had always sort of known, but just talking to him more, and then my mother and mother-in-law, and getting them to help with George, my son. And yeah, I think it was just actually talking to my GP teacher. He was just fantastic, Fergus Aitchison, each week, and just sort of trying to develop techniques to deal with some of the things that I was struggling with at work.
And this was an isolated practice as well, wasn't it?
Actually, this was in Gisborne,
oh, is that
which
right?
I suppose Gisborne is a wee bit out on a limb.
Tiny small town.
Yeah.
Exactly.
In English terms.
You certainly sounded isolated, and you made the point that in the hospital life you were surrounded by lots of colleagues all the time to assist you with clinical decisions as well as how you're feeling. Whereas here you were on your own and doing everything on your own. I think the question which I'm keen to ask is, if you'd been involved in the rural network for many years and this had happened to you, how do you think the network could have helped?
Yeah, I suppose I hadn't even really thought of the network. I suppose maybe in having access to someone out of the medical arena who you could talk to and feel really confident to talk to and comfortable. So one of the things was maybe having some cognitive behavioural therapy. There's some of those things that when you're in a smaller area, it's really hard to access those sort of talking therapies. I definitely think that would be really beneficial. So yeah, CBT or counselling, that would probably be one of the big things that I think would be beneficial.
Good for you. So I suppose the question behind the question is, if you were involved in the mentoring tier of the network and somebody approached you saying, they told you the story which hugely resonates with you, and you were quietly thinking to yourself, I've been there, how would you help then?
I think just sort of being there to talk to them and just saying that I've been in the same situation and I managed to get through it, because sometimes you just feel like it's this big black mass and you just don't know how to move forward. So just recognising that other people have been there and had the same problems, I think is the first thing to acknowledge. And then yeah, just being able to, like my teacher had shown me just different techniques about how to get through it, which some of them I'd talked about in my talk. I just think that was really helpful, just having someone there to talk to.
And it didn't put you off general practice and make you hurry back to hospital medicine then?
No, I actually really loved general practice.
Yes.
It was a fantastic year, and I loved the challenges of it, and I probably found it's way harder than you think, and you're not just a GP, it's actually a really fantastic job, and just love the people and that whole continuity of care thing, whereas you don't get that in the hospital.
Bless you. Look, that's a really beautiful positive note to finish on, and Lucinda, I really thank you so much for sharing what you shared just now on the settee, but also back in the session sharing it with the whole group. It was well worth the standing ovation you got, so bless you. Thank you very much indeed.
Thanks,
I appreciate
Buzz.
that. Thank you. It's great.